My name is Sanjay Gupta. I'm a cardiologist in York. Today's video is on the subject of medical rationing. This video is entitled What COVID Taught Us About Medical Rationing and Misjudgment. So as time passes and we begin to make sense of the storm that was COVID-19, one of the things we must reflect on, no matter how uncomfortable, is medical rationing. In a time of crisis with limited ventilators, ICU beds and staff, rationing became a reality. But the question isn't whether rationing was necessary. The question is, how was it done? And who paid the price for how we made those decisions? It's true, in any emergency, resources must be prioritized. Not everyone can receive every intervention. But during COVID, many decisions weren't just based on science. They were shaped by assumptions about age, disability, frailty, neurodiversity, and quality of life. Some people, especially the elderly, the disabled, the neurodivergent, were quietly deprioritized, not because they couldn't survive, but because someone else judged their lives to be less important. In many institutions, frailty scores and comorbidity charts were used as blunt tools to decide who deserved ICU care. But frailty isn't destiny, disability isn't death, and comorbidities, whilst relevant, don't tell you how someone lives, loves, or even recovers. In trying to save the most lives, we sometimes forgot to value the life in front of us. And there was a cost to the marginalized. For those with chronic illness, learning disabilities, autism, or advanced age, this was more than rationing. It felt like abandonment. Many were denied access to ventilators or escalation of care, not because they wouldn't benefit, but because their baseline existence was already viewed as suboptimal. That's not triage. That's triage laced with bias. It reminds us when healthcare becomes purely utilitarian, the most vulnerable often become invisible. What could we have done differently? Well, we could have involved ethicists, patients, and families in decision-making frameworks. We could have recognized that data alone doesn't reflect dignity. We could have chosen transparency over quiet exclusion. And we could have remembered that rationing is not just clinical, it is moral. And perhaps most importantly, we could have been more honest with the public about the impossible choices we were making, so those left behind weren't left in the dark. We have to learn from this. COVID revealed not just our fragility, but our ethical fault lines. We must build a healthcare system where decisions are rooted not only in evidence, but in equity, where life isn't valued by how productive or independent someone is, and where rationing, if it must occur, should be done with humility, compassion, and accountability. If we don't talk about this now, if we don't look back with honest eyes, we risk repeating the same mistakes in the next crisis. Rationing may be inevitable, but how we ration speaks volumes about who we are as a society. Let it never be said that some lives were worth less, not in our hospitals, not in our hearts. Thank you so much for listening. I would love to hear your thoughts.